Good afternoon. I would like to thank organizers for my invitation and thank you for your attention in these difficult times. Here are my disclosures. I will share some of our experiences in PrEP introduction in Czech Republic. Here you can see our Czech guidelines that were elaborated based on WHO recommendation in 2017. And our center, HIV Center in Military Hospital Prague, is a pioneer in PrEP introduction in Czech Republic, and we have the most of patients, most of PrEP clients in Czech Republic. Here you can see our capital before COVID-19, and I will present you our data from the period before COVID-19, from October 2017 to January 2020. And during this period, we have 230 PrEP candidates. The number of candidates increased every year, and the majority of them were men having sex with men. And this is like in accordance with epidemiologic situation in Czech Republic. The average age was 35 years. And we recommend PrEP to all partners of newly diagnosed HIV positive patients and also to patients on post-exposure prophylaxis. Here you can see country of origin of our PrEP candidates. The majority of them were Czech, but we had 1/4 of foreigners, especially from Slovakia, which reflects unfavorable situation with prevention in Slovakia. We administered PrEP in 199 of total number of candidates, in the majority of them on daily regimen, but we can also see a trend to on-demand regimen and switch of regimens according to patient's situation. We tested positively HIV in initial screening in 2 clients, and the rest of candidates they are postponed for PrEP. Concerning efficiency of PrEP, none of our clients was found newly infected with HIV during our follow-up. I will discuss a little bit side effects of PrEP in our cohort. We observed mild creatinine elevation in several patients. Usually it was sufficient to discontinue protein diet, to hydrate sufficiently, but in 3 cases, in 3 clients, we need to temporarily discontinue PrEP or switch to on-demand regimen. But all of these clients, they can continue their PrEP. They are tested more frequently, and we also in our cohort we have 2 patients with nephrologic history, and both of them are in high risk of STDs, so they are both on PrEP more than 1 year, and they don't have any side effects, any complications. We have in 19 clients, they discontinued PrEP for personal reasons. We discuss for cases of non-specific symptoms such as paresthesia, fatigue, headache, but in the end, all these patients, they continue their PrEP without symptoms, so no connection was found with PrEP in the end. In some cases, we consult clinical pharmacologists, especially in psychiatric patients with medication, and in some cases they recommend us bone screening in cooperation with endocrinologists. Here I will discuss a little bit sexually transmitted diseases. We check all patients like initially and then during PrEP use. In the first two columns you can see the data from all candidates, and it is interesting that we had these two patients HIV positive in initial screening, and also we can see a combination of several sexually transmitted diseases. And in the third column there are data of PrEP clients already. To conclude, STDs problematics in our PrEP cohort, more than 1/2 of candidates had a history of sexually transmitted diseases in the past, and about 20% of candidates were tested positively for some STD in initial screening, and during PrEP use, during PrEP follow-up, it was about 21.6% of new STDs. The most of these diseases were asymptomatic. This is in accordance with literature, and nowadays more frequent STD screening is recommended for patients on PrEP. Now I will discuss a little bit situation after COVID-19. In last 8 months, I will try to present you our situation in Czech Republic. In our HIV center, in our hospital, because of COVID epidemic, it was because we all have to work with take care of COVID positive patients, and we were able to take care also some acute patients, HIV patients, and so on. But it was not possible to take care of prevention PrEP clients. So we communicate via e-medicine, and we accepted only 53 new PrEP candidates. And nowadays we don't have any more capacity for new clients. And in the future it will be complicated to manage our clients, PrEP clients, in this epidemiologic situation. Fortunately, NGO Czech AIDS Health Society, which is NGO that is most active in the field of HIV prevention and social part of this problematics. They open a PrEP center, sexual health center, in March, and we collaborate with them, and they have already 108 PrEP clients, and some more of clients are postponed for PrEP, and if I can estimate PrEP use in Czech Republic, it's about a total of 500 clients, and we will see what this COVID epidemic will change in PrEP use in Czech Republic, if there will be a need of PrEP in the future in lockdown, and where it will be the best way to provide PrEP. And and to conclude my presentation, there is a high demand for PrEP in Czech Republic. We found good efficiency, and PrEP was well tolerated by our clients. We suggest that PrEP implementation plays role in the decline in HIV incidence in Czech Republic over past 2 years. And we detected several new HIV cases and other STDs, mostly asymptomatic. It is favorable to increase PrEP availability to people that are in a high risk, and there are several barriers for this goal, but nowadays we will see how it will develop, especially with COVID situation. And I would like to thank especially to my colleague, Dr. Zlámal, and thank you all for attention.